in.
Hi, my name is Essie. I'll be your nurse. I have some doctor orders to do a heart-lung assessment on you, along with the fall risk and a safety assessment. Is that fine with you?
Yes, ma'am.
Okay, I will perform hand hygiene and provide privacy. Can you tell me your name and date of birth?
Alexis Williams, 1695.
All right, can I see your wristbands? Thank you. So I'm gonna start off by listening to your heart and I'm going to use the diaphragm side to listen to her heart sounds. And this is kind of to the center of her chest. This is the aortic valve. And then I'll go laterally over to her pulmonic valve, which is in the second intercostal space. Then I'll go down to the third intercostal space, which is the Erb's point. The fourth intercostal space would be the tricuspid valve. And then I asked her, can you lift up your breast for me so I can listen to her mitral valve, aka apical valve, apical pulse, and I would listen for a minute. And for the purpose of this video, I'm doing it on over her clothes. In real life, we would do it on bare skin. I will also turn my stethoscope to the bell side to listen for murmurs. And I heard no adventitia sound throughout her heart valves. I'm going to get you to turn your head to that's all right. And I'm going to check for JVD. All right, I'm going to get you to turn your head the other way. Check for JVD. Not noted. All right, I'm going to go ahead and listen to her lung sounds. And I would start off listening to her left upper lobe. No, this is her right upper lobe. Sorry. Right upper lobe, and now I'll go laterally over. Left upper lobe, right middle lobe, left lower middle lobe. And also, every time I touched her, she would take a deep breath in and exhale out. So I'm gonna get you to drape your arm over for me. And this is right laterally. Take a deep breath in. Yeah. Take a deep breath in and out. It's posterior laterally. And I'm gonna go on this side. Take a deep breath in. Yeah. It's anterior laterally. Take a deep breath in and out. Posterior laterally. And I'm gonna get you to lean forward for me. I'm gonna listen to her long sounds this way. So this would be her left upper lobe. So I'm gonna get you to breathe in. Right upper lobe. And left upper lobe. Left lower lobe. Left, right lower lobe. And there are no adventitia sound noted throughout her lungs. Now I'm going to check her pulse, her radial pulses. So I will check her pulses, and I will do this bilaterally. Her radial pulse is 2+. All right, I'm gonna check for the capillary refills. And they're less than 2 seconds. And then I'm going to check for upper extremity edema. And no edema noted. And so I will check down here her duralis pedis pulse and her posterior tibial pulse. And then I will check for her capillary refills in her toes, which is less than 2 seconds. and those pulses, thoralis pedis, and her posterior tibial pulses are bilaterally 2+, and her radial pulses are bilaterally 2+. Also, I want to know, do you have you ever had chest pain, a history of chest pain?
No, ma'am.
Do you have a cough going on?
No, ma'am.
Do you have any sputum?
No, ma'am.
I also want to educate you about the incentive spirometer. What you'll do is you'll like blow in it, and the little valve will go up, and you'll do this 10 times an hour, preferably during the commercial break, and it just helps remove extra mucus out your lungs. I also want to teach you about the turn cough technique. So what you'll do, you'll inhale, turn, and let out a cough, and it helps to remove excess mucus as well. All right. So also I want to ask you about your fall history. Have you had a history of falling within the last 3 months?
No.
Okay. Do you use anything that assists with your walking?
No.
And do you feel like you're impaired at times when you're walking? Like, do you have trouble? Do you feel weak?
No.
And do you know where we are?
Yes, the hospital.
The hospital. Do you know what year it is?
Yes, 2023.
Okay. And do you know your birthday?
Yes, January 6, 1995.
All right. So also I want to know, do you need to go to the restroom?
No.
Do you need to be repositioned?
No.
Do you need any pain medicines?
No.
And do you need any personal items close to you?
Just my phone.
Okay. So I'll make sure your phone is close by you, and I'll make sure your walkway is clear. And if you need anything, just let me know. Just hit the call light button, and I'll be on my way.
All right.
So I will document this stuff and let the provider know.
All right.
All right. So I will perform hand hygiene and provide privacy and leave.